On the road, in the gym, at a coffee house. No matter where you listen, this is Prevention Perk. I'm Steve Miller with Mid-America PTTC. It's time to perk up our prevention efforts. My guest today is Amy Ronshausen, the Executive Director of both Drug Free America Foundation and Save Our Society from Drugs, SOS. Both of these national nonprofit organizations work to defeat drug legalization attempts, promote sound drug policies, and prevent drug use, abuse, and addiction. Amy is passionate about reducing illegal drug use and drug prevention, coordinating grassroots advocacy campaigns, prevention summits, analyze and track state and federal drug policy legislation, and training prevention professionals at local and national conferences. Amy, welcome to Prevention Perk.
Hi, thanks for having me.
Well, I'm always excited to hear about how each of our guests find their way into the kind of work that they're doing. And from reading your intro bio, you're knee deep in all of this, but I'm kind of curious, how did you get into doing prevention work?
So really by chance, when my husband and I got engaged quite some time ago, I knew I needed a real job. And I had a friend who worked at a treatment center that was here in Pinellas County, where I'm located, at their call center. And so I applied and I got the job, and I just kind of fell into it from there. But as I've moved through this world and as I've grown up in this world professionally, I realize it's kind of where I was meant to be. When I was younger, growing up in my family, my sister had some substance abuse issues. And at the time, I really was looking at it when I first started in this world from the lens point of my parents, because I saw that they didn't know what to do. One daughter, me, didn't get in any trouble. And then my younger sister found herself in trouble often. And they just didn't know who to contact or where to go, because, drugs was a new issue to them. They didn't do drugs. They didn't know people who did drugs. And I think also this was, I'm 48 years old. This is when I was in high school. So 30 something years ago. They also, probably felt a lot of shame and didn't want to tell a lot of people what was going on because they really weren't sure. And so when I first got into it, I kind of wanted to, help people like my parents. Like, where do they go for resources? How do they go? How do they get help? But as I've grown in this field, I've moved more toward, I still want to help people like my parents, but it's given me a greater understanding of who my sister is and what she's gone through and why those things happened, and that it wasn't necessarily that she was choosing drugs over her family. And that's the way I felt as a teenager. But now, as I learn about the disease of addiction and, the outside factors that play into that, I understand more of where she was at that time. And also I see how this has affected her throughout her life. So now, not only working toward people to give them resources like my parents, but also, standing up for people like my sister, one, to build prevention so that doesn't happen, but two, to have, access to effective treatment strategies, and then also to build that recovery community where, people who recover from substance use disorders can thrive and who can teach the rest of us a lot of things.
You're listening to Prevention Perk. The funder of this project, along with all the other products of the Mid-America PTTC, is the Substance Abuse and Mental Health Services Administration. Although funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. Did you know nearly 700 publications and digital products are available online at store.samhsa.gov? Knowing the kind of work that you're doing now, which is not just nationally, but internationally, you've probably seen this through an interesting lens. So my question really is given from where you started and where you're at now, do you feel like that we're still in the I don't know how do you quantify this, but the early stages of developing like prevention and the treatment field? Do you feel like it's still like brand new in some ways? It's still evolving?
I do. I think that even in the last decade, there's such a difference from when I started in this world 20 years ago, just in throughout the last decade, where there is a real push toward professionalism. And it isn't just, this was my lived experience, so I know what to tell you what to do, and this is how you should do it, and this is how you get better. Now there's evidence-based strategies, and there's a real science to prevention, and it's teaching people that science and making sure that they're using those evidence-based strategies so that they are effective, because sometimes when you veer from that, you can actually do more harm than good. So I think that there has been this real push toward that professionalism in our field, and that's really exciting to see.
Yeah, it is. And that's where I just kind of was thinking that you probably had a broader lens on that. Not that I said, is it evolving? It's probably always going to evolve. It's just, I find it exciting that it's becoming more, and we use the word professionalized, but it's just becoming more of something that I'm hoping um, people will say someday, gosh, when I grow up, this is the kind of work that I want to do. Because most people now say, I don't know, I just kind of stumbled into it, or I wanted to help a friend or family member, but we don't often think of it as something that's in the behavioral health or public health realm. That's something else. And this prevention is just something that a bunch of people are trying to do good about or something, but it's actually a career for a
Yeah,
lot of people.
yeah, and I think we are moving there. We hosted a youth summit in Kerala, India, earlier last or late last year in November, and part of the youth forum was young professionals who want to be in this field. They're going to school for public health, and I wasn't sure what to expect when I walked into that room. I wasn't sure if they were going to be high schoolers, or these people were out. I mean, I made me feel stupid. They out educated me by multiple degrees, and they were all in it to make better communities, safer places to grow up, because they see the environment that they grew up with as children, and making sure that others have a good environment and a good community. And they are all double majors in different public health issues and coming up with prevention projects. And so this was a room full of young professionals who wanted to be preventionists. So it was really
Exciting.
exciting.
That is. Well, for today's purposes, I had talked to a couple of people. I said, I'd really like to have somebody on the podcast and talk a little bit about marijuana as a specific subject, and how. I mean, that's a changing landscape, and so I'll frame that a little bit. But everyone one that I had spoke to kept saying, "Well, you should talk to Amy because she kind of not only knows what's going on domestically, but she kind of has an understanding of what that looks like." Um, Internationally in some regards. So that's kind of what I wanted to look at. But so the Mid America PTTC, as you may know, is four states in the Midwest: Missouri, Iowa, Kansas, and Nebraska. And then so I was doing just a little bit of research to see where marijuana stands, because in Missouri, just very recently, it is now fully legal. That's medicinal and adult use, and then decriminalization. But then in neighboring states, it runs the gamut from a mixed status to medicinal CDB only to null and void, none at all. Kansas is fully illegal, no medical, no decriminalization. So it's all over the place. And so, making sense out of all that, whether you're in this for a profession or if you're moms and dads that are concerned about their kids, this is an interesting environment to try to navigate. So I want to kind of talk a little bit about um, just kind of how you see this unfolding, and what do you think this overall impact of legalization of marijuana is having on our communities, but more than that, the conversation around drug use.
Yeah, well, there certainly isn't anything good coming out of it. I can start by saying that. Um, I was just at the Commission on Narcotic Drugs meeting in Vienna, Austria, and we hosted a luncheon for member states of the African Union and the European Union because they're also looking at these same policies. And, the United States is kind of looked at as, the headliners of drug policy and things like that. And although we haven't legalized recreationally at the federal level, we have, like you said, all these states doing basically whatever they want. And every state is different on, even if 19 states have recreational marijuana, each one of those laws is different. And so, you really have to be aware of what your law says and what it does. But, at this luncheon, we were pointing, we just had a quick hour. And so we talked about the impacts to public health and public safety. And, there isn't anything good that's come out of this so far. And I think it really, the previous US Surgeon General, I think really said it best when he said there is no acceptable amount of marijuana use for youth or for pregnant women. But he really looked at those two at-risk demographics and said that, there's no use is acceptable, no use is good. It's all harmful because of the type of products that we have out there. And I think that, people that aren't in this drug world look at these policies and you see legalization and you're like, well, yeah, I don't want somebody going to prison for the rest of their life because they were smoking a joint, which, by the way, doesn't happen. But let's just say that that's what people think. None of us want that. But what I don't think people realized, even in some states, we hear some people that did vote for these things, and years later, they're like, yeah, this isn't really what I thought it was going to be. I didn't realize there was going to be a retail shop on every corner. I didn't realize there was going to be mass marketing. Everywhere you go, you look, you see these signs. It's being, marketed by big time social influencers, movie stars. Our youth are bombarded with these messages and with these products and with this lifestyle. And I think that, that's probably the worst part of it, because research tells us that 90% of addiction starts in adolescence. So if this is the message that we're sending to our adolescents, that this is safe or safer than other drugs, or that it's natural and it's okay to use. And when youth see something as legal, that's what that means to them. They think legal equals safe, because why would something be legal that's bad for me? So we're decreasing that risk associated with it, which then is going to increase their use. And it's trapping us in this cycle, and that's the cycle we're trying to get out of. We're in this opioid epidemic and we're wondering how we got here. But if we don't start at the very beginning and prevent these things from happening in the first place with our adolescents, we're going to be in this endless cycle of trying to treat our way out of this problem. And I don't think we can do that. It has to be both.
So just to play devil's advocate here, because you'll say nothing good has come out of this. But then I'm too old, so don't even look into this too much. But if you look at Instagram or TikTok or follow YouTube influencers and all that, they tell a completely different story. This right, wrong, liberal, whatever it is, conservative, that discussion. How in the world do we know that nothing good is coming out of this? Because if you listen to them, all these great things are as a result of now that I have access to marijuana.
Yeah, well, I'm not sure that they're talking about a whole bunch of great things. They're just marketing a product that they're getting paid to market. So that, they're getting something out of it. They're not doing it because they believe in this product so much and it's such a wonderful product. They're getting paid to influence you to use it. There is the conversation that it could be the answer to states' economic crisis, or it could bring in more money to states. That's probably the number one thing that they look at as a positive. But when you actually break it down, it's very similar to alcohol and tobacco. Do we bring in a lot of money from the tax revenue from those two addictive products? Absolutely, we do. Does it even compare to the amount that we pay out in healthcare costs and public safety costs, not even close. And so marijuana is kind of in that same bracket. And even though states are bringing in money from the taxation, even if you don't look at the societal harms that it's causing and that you have to pay for it, it also, when you look in the larger scheme of their budgets, it's a drop in the bucket. So to me, a million or $1 billion sounds like a lot of revenue that you're bringing in. But then when you look at the full budget of a state, that $1 million is probably less than 10% or 5%, or maybe even sometimes 1% of that state's full budget. So it's not the economic windfall that everybody had hoped it would be. But other than that, I mean, when you look at the problems that it causes with physical health, with mental health, with public safety, with academic success for our youth, um, that's what I mean when I say that it hasn't brought us anything successful. There hasn't been any positive impacts yet from the, legalization of this
It's not
product.
all just sunshine and bunnies.
No,
Yeah.
no, not at
And
all.
I find that interesting because I'm old enough to, have grown up, with the just say no. I remember the hippies. I remember my parents' um, disdain for the hippies and the hippie lifestyle, and talking about the drug culture and counterculture and all that stuff. And you couldn't have convinced me until fairly recently that we would be where we're at now. And I'm a person in long-term recovery, so I have my own history. I just never thought we would be at this point. And sometimes I just wonder how is it that we did arrive here? Do you have a sense for how this train left the station and how it continues to have momentum? Because it seems like state after state after state, even though you
Yeah.
hear reports out of some of the first adopters of marijuana, the states that did, they still have a lot of questions and concerns about it, and yet the train's moving.
Yes. And it's a fast moving train. Yeah. I mean, the marijuana movement is really interesting because it started off, you know, as um, like a protest of the man. This was, a protest against war, a protest against, you know, uh, big business, things like that. And so it was a very small counterculture, thing of that hippie movement. And marijuana is now the man. Like it is not, it's men in business suits. It's, big time Wall Street. They have a lot of money. There isn't anything, counterculture about it anymore. They are right up there with the biggest lobbyists that we have on any other issue. I think that, when you ask about how it started and how it's, kept going and where it's going, from the perspective of somebody who's not in this field, it started off as a possibility, a medical possibility for people who have, different chronic illnesses or untreatable illnesses, mostly end of life situations, is what they told us, right? And so for the normal person, this is where it first came out. This is where we first heard of this push for this movement. But if you do some digging into these organizations that started this, back in the mid and early 90s, that was a very specific strategic plan of theirs. They used medicine as a red herring. And, and in their words, if we can get them to believe it's a medicine, we're on the track for legalization. Because once we've introduced it as a medicine, it's not that bad anymore, right? It's more acceptable. But even when you look at it as a medicine, so when I first started in this field, I came from the treatment world, and then I worked in the adult drug court for a while. And when I first came on at Drug Free America Foundation, I had never even heard of medical marijuana. And I was in the field for quite some years, but this was something I had never heard of before. Never heard those two words put together, didn't know what we were talking about. And I read a ballot initiative from another state. And the way that it was worded led me to believe, as somebody who worked in this field, that this is some special magical marijuana. This isn't the stuff that I could buy on the street. This is something a doctor is recommending. So this must be good, right? And this is me coming from the drug world. So imagine somebody who's, your next door neighbor who's a school teacher, or, a normal person who's not working in our field, right? So I think most people believed that, well, this isn't marijuana that I know of. This is some special medical marijuana. And who am I to say that somebody with an end of life or chronic illness shouldn't have access to this? But the implementation of these bit laws have been quite different. I mean, I think that last time somebody told me, I think the average age of a medical marijuana card holder in the state of California is like a 32-year-old white male with no history of chronic illnesses, but surprisingly has a history of substance use. So it's become you can get it for my feet hurt from wearing high heels, to anything is that, I have a chronic illness. So it's just gone so far out there. And once you've introduced it as a medicine, then we've seen this industry play off of almost all of our big things in society that we think about. So first it was the medicine, and they had people come in wheelchairs. And then it was our vets, because we know that, well, most of us know that we don't provide adequate health care or mental health care for our veterans when they come back to us, and we should be. And so this is always something that is in the policy world a very active part. And so I think that they saw that. So they said, oh, you know what the answer to that problem is? Marijuana for our veterans. We're in the middle of an opioid crisis. Guess what was the answer to the opioid crisis? Marijuana. If we can legalize marijuana, less people use opioids. Well, I don't know if you've been tracking the number, but every year the number of overdose deaths increase, including in states that have legalized marijuana. So it has done nothing to help the opioid epidemic. They look at social justice issues. When we're looking at reforming the criminal justice system, guess what the answer to that is? It's also marijuana. If we can legalize marijuana, we don't have people in jails or prisons, because apparently that's the only crime people commit. And we can figure all that out. So they've been really good at tapping on to every movement that tugs at our heartstrings, to be a part of that. And now they are also fully funding themselves. So 20 years ago, it was a handful of millionaires, maybe billionaires, who helped fund this movement. Now you have the industry themselves with so much money that in the state of Florida, they've already put 25 million, this one dispensary chain, 25 million into the recreational ballot initiative for 2024. This is the same dispensary chain that told us in 2014 that they had nothing to do with legalization. Medical marijuana was its own thing, and this wasn't a stepping stone to legalization. Here we are a few years later, $25 million toward that ballot initiative. So they're funding themselves now. So to me, that's kind of the evolution of where we are with this. They're using a lot of the same tactics that the tobacco industry used, but it's something that is now so well funded within their own scope that they really don't need a lot of outside help anymore. And that's, I think, the scary part.
Yeah. So breaking it down a little bit, because, the way you explained it, it simplifies it and illustrates it, hopefully for the listener. But let's say for a parent's guidance around this, what's the conversation they should be having with their teen or their child, wherever they decide to start with their prevention initiatives? What's that conversation they should be having specifically around marijuana?
Well, hopefully that conversation starts sooner than later, because we do see the age of initiation creeping down lower and lower. And I think that, when I talk to a lot of my friends who have teenage parents and they ask about this issue, kids are smart these days. I'm not saying that we weren't smart when we were younger, but we also didn't have this computer that we held in our hands that told us everything we needed to know all the time. So I think that with today's youth, giving them the science behind it is really important. And the one reason why we focus on youth and prevention is because they're more at risk because of the developing brain. If research and science tells us that adolescent brain isn't fully developed until, I mean, first they said 21, now we're looking at more 25, 27-ish, depending on if you're a male or a female. Um, so these are things that would impact that brain. Use of alcohol, tobacco, marijuana impacts that developing brain differently than it impacts a fully developed adult brain. So the concerns are different. So I think talking to the youth about your brain, I mean, this is the organ that you're going to have for the rest of your life that's going to keep you going, keep you alive, make you successful, and protecting that brain for as long as you possibly can. And while our focus in this conversation is marijuana, really interesting a study done by Dr. Bertha Madras, Dr. Robert DuPont, and Dr. Carolyn DuPont looked at the Monitoring the Future survey over the last, I think, 20 something years. And they pulled the data and they asked the question, is the use of one of these drugs or any of these drugs at one time, does that make any impact upon a youth's use of other drugs in the future? And what they found was if a youth uses alcohol, marijuana, tobacco, any combination of the three, any one of the three, their likelihood of using other illicit drugs while in adolescence is so much more higher than those of their peers who haven't used. And so I think that that's what's important for parents to understand, that if they can keep their youth drug free, which for some reason sometimes is a controversial statement, but if they can keep their youth away from alcohol, marijuana, nicotine, any drug, even if until they're 21, 18 to 21 years old, the chances of them ever having a substance use problem in the future significantly declines. That doesn't mean that they might not use those substances later on, but they might not have a substance use disorder. That's what declines. And so I think that that is something that parents can understand. Like, I don't have to tell them that they can't use this forever, which I hope that that's the choice that they make. But if I can just get them through those teenage years, I'm setting them up for a more successful life in the future. And I think that that also is easier for youth to understand. This is the only brain I'm getting. God knows I'm doing enough damage to it with the social media and the other things coming at me. But if this is so harmful to my brain, I live a long lifetime. I can hold off on using these substances and make that commitment to myself for reasons of health to abstain from the use of these until I'm an adult. And then at that point, let's just hope they make the decision not to use it all, because they've other things have come into play at that point. And, they know more.
Yeah, that's good. So I'm kind of curious if you have some maybe lens on so with legalization, we're talking about with marijuana, but how is that informing or impacting the discussion around drug legalization?
Well, it's moving. So there's a lot of conversation right now. It's not just the legalization of marijuana. As you probably know, there's a few states who have already decriminalized psilocybin and the production of and the sale of that, which is, your magic mushrooms for common terminology there. Um, and now we also have this move, and there's been a lot of reports in the media about it. I heard an awful lot about it at the international conference I was just at, and it's the move to legalize psychedelics as medicine or for recreational use. And again, they're going down the same path as with marijuana. They're really pushing for that medicine part first, but their end goal is, full legalization. So, it's not just marijuana that we're looking at anymore. It's all the psychedelics now as well.
So I kind of wondered about that, and you've maybe answered my question that marijuana kind of is the leader in this, but as we see it being more wholesale adoption of marijuana use, is that is that trending globally? It's like, well, if marijuana is okay, then let's talk about psilocybin, and then
Yeah.
that's pretty much being discussed because you said internationally. That's a conversation that's being had now.
Absolutely. And I think it's a conversation that there's no way we would be having if we didn't introduce marijuana in first, because that's the easier one to swallow, right? It's something that more people are familiar with. When you look at drug use rates, it's, outside of alcohol, it's the number one drug that people consume and use globally. So it was an easier one than to come out of the gate and say, hey, let's legalize MDMA or LSD or magic mushrooms as medicine. But now if you're looking at it, from the selling side of them, if we've said it's okay, if we've determined that marijuana is a medicine by legislative or ballot initiatives, then why wouldn't the same hold true for any other substance, with the argument that they have?
That's my
And so remember, yeah, they're bypassing all of our consumer protection, by bypassing the Food and Drug Administration or the equivalents in other countries. But yeah, it's definitely, something I'm getting emails and WhatsApps about every day. So it's not as pushy yet as the or big as the marijuana industry, but it's crept over the
so you
horizon.
kind of have a 30,000 foot view of all of this, or kind of a pulse. Um, is there already conversation, and I'm not saying at your level, but out in this pro legalization arena, let's just legalize it all? Is that the end game? Is that what?
I mean, I can't speak for all of these organizations. I think that some organizations, that are promoting legalization are fixated on one drug or another. But there is a movement that sees drug use as a human right. It's part of our, it's a personal right, it's a human right. And who is the government or who is the lawmaking entities to say what we can and can't do? So from that kind of group's perspective, it is inclusive of all drugs, and you know it, that's a that's definitely harder to push through. So it's kind of one drug at a time. But there are some organizations that make no apologies for seeing that drug use is a human right, and that it should all be legalized. And in some stances, some of these organizations think that it's the country's job to provide those drugs to the citizens, that it should all be federalized.
Oh, wow, that's a conversation that I'd like to squash immediately. But
Yes, yes.
I'm kind of curious, if there's all of these strategies going on for legalization. Do you have kind of a hint of how prevention professionals are kind of changing their strategies to to be more inclusive, to be not inclusive, but how are they changing their strategies to really get ahead of, or at least keeping pace with, legalization discussion and realities?
Yeah. So there's a couple things. The first one is, and I remember this from when in 2016. In Florida, we defeated medical marijuana in 2014, but it came back in 2016, and unfortunately, it passed. And we knew it was going to pass probably about a month before the vote. We just, that we did the polling, we knew the numbers. And my husband looks at me and says, so what's going to happen here? He's like, are you going to want to move? And if we're going to move, where are we going to move? Because this is everywhere now. And, what does your job look like? And I just kind of sat back and I thought about it for a minute, and I said, my job doesn't change. Like I said before, marijuana is the most common use substance behind alcohol. My job, the job of preventionist, is to prevent that use, whether it's legal or not. It's a little bit harder for us if it's with all the marketing and things like that, but it's still just like alcohol. You still don't want binge drinking, you still don't want underage drinking, you still don't want impaired driving, and that substance is legal, but we still do a whole bunch of work around it. So we still have a lot to do around the marijuana issue, legal or not. So in some cases, I tell people, so what? Your state's legalized marijuana, so what? Your job is still the same. We need to do some things. Where the difference comes into play is our strategies. So as preventionists, we have a toolkit of all kinds of strategies. And I think that when you have marijuana legalization in your state, you look at some specific strategies to mitigate the harms. And those might be looking at caps on THC levels, looking at how and when and where they're allowed to advertise these products, looking at the type of products that you're allowed to sell. I mean, do we really need gummy bears and soda pops and cookies and cakes and granola bars? Should you be able to eat it, use it as a lotion, use it as an oil, smoke it, use it as a shatter? So it's lessening the access and availability and the ways to use these products and the products that are on the market to best mitigate the harm that's associated with them. So there's a lot of work that can be done around that. So in one case, it's the so what, your job as a preventionist is the same, but also it's so what, we've got our work cut out for us, and here's a list of things that you might want to talk to your lawmakers about to have put in place so that we don't see what happened in some of these other states, and also looking at the other states. So we look at Colorado a lot because they're one of the first states to have recreational marijuana, and they've been doing it the longest, so we can take the data from that state, but also looking at their evolution as a state in this process. They started out as what you would think is the Wild West when it came to what their original law said. And while they still have lots of harms and things aren't great, they have been putting things in place to help, mitigate these harms, whether it be when it comes to driving, advertising, THC levels, different things like that. So there's lots of things that we can do as a prevention community to put policies in place that make this more difficult.
Yeah, that's great. I appreciate you sharing that. So I'm going to put a link to Drug Free America, and then I'll also have a link in the show notes for your SOS. But I'm curious, are there some other resources that, whether you're a professional or maybe you're a parent listening to this or both, are there some resources that you think are really valuable for others to maybe take a look at?
Absolutely. So I think that it depends on where you're at and how deep you want to get into this issue. I think that for youth and for parents, a great resource that is one that we promote is the One Choice initiative, and that's the by the Institute for Behavior and Health. That's Dr. Bob DuPont and Carolyn DuPont's organization, and that's an initiative that basically says that youth have the one choice, and that one choice is to be free of all these substances for reasons for health. So they have a lot of good toolkits and materials, things around that issue. At the global level, the Listen First campaign out of the United Nations Office of Drugs and Crime is really amazing, and they have a parent toolkit, and it's really about just educating parents and on how to be good parents. So it might not necessarily be all about anti-drugs, but when all these other protective factors fall into place, it really, provides for a more holistic approach to drug prevention. And then there's also Smart Approaches to Marijuana, SAM, which is an organization led by Kevin Sabet. And they have a lot of great resources on the impacts of legalization and different reports and lessons learned. I would say this is for the more advanced person who wants to get involved at the policy level and wants to know, what to talk to their legislators about. So those are a couple off the top of my head. And I think there's one in Colorado as well called One Chance to Grow Up. And they have a lot of great resources as well, because, they've been in this for quite some time. And they started out, opposing the ballot initiative to legalize, but now have lived through it for this. I mean, I think it's been a decade now. And so they have a lot of good resources on there for educating youth, but also for talking to policymakers on these different topics. So those would be the couple off the top of my head.
You're listening to Prevention Perk. Learn about the real risks for people who use marijuana, especially youth and young adults and women who are pregnant or nursing. SAMHSA has online resources available at samhsa.gov/marijuana. Before we get away, is there something that we haven't discussed that you want to make sure that the audience knows about, or what's your sage wisdom for us, Amy?
Oh, sage wisdom. Well, you kind of lost me with that one, but I will say this, like, you just have to find a part of this that you're passionate about and just share it. It doesn't matter if you're sharing it with your neighbor when you're taking your trash out or you're at your mailbox, and just find out what out of all of these drug things is most important to you. Is it the traffic safety issue? Is it the youth issue? Is it the medicine cabinet issue? Because if you can just take one of these things and share that information, you don't know whose life you're saving, but I can guarantee that it's somebody's, because you've told somebody who then is probably going to tell other people. And you don't know how many times somebody has told me that something that they heard from a friend about this issue, they were able to share with somebody, and that was life changing. So you don't think it's a lot when you're doing it, but it really does mean a lot to other people. And then the last thing I would say is just to, if you are somebody has a substance use disorder, or somebody in your family or a friend has one, not to give up hope on them. It might take them 1,000 times to try, but when they come back to you, they're better than you remembered them to be in the first place. So just hold on to that hope that, people do recover, and things do get better.
That's wonderful. And, early on, you made the statement about, in regard to your sister, about the kind of the shame about it. And then what you're saying about talking to your neighbor, whether it's at the mailbox or whatever, is kind of that pay it forward. And I think that this is a common theme, whether we're talking about drugs or we're talking about different risk factors, talking about mental health, is that there's either this shame, or I kind of look at it also as the stigma. And just having a conversation about it will go so much further than never saying anything at all. It never ceases to amaze me that it's almost taboo to even briefly say it. It's almost like we're not opening the door to an arguing about it. It's just, I'm sharing this information for no other reason than I think that it's valuable to be shared. And I think that kind of breaks down that stigma, that wall that says, no, we just don't talk about this kind of stuff.
Yeah, and with 100,000 people dying every year, Americans dying, we don't have the option of being quiet about this anymore. Like, there is, that alone should break down the stigma. I've been in this world for my whole adult life now, and every single time I meet somebody, they know somebody personally who is impacted by this. Whereas when I first started, it was they knew a friend of a friend of a friend. So this is personal to almost every single one of us now. So there should be no shame and stigma. And the more we talk about it, the more we can make sure that happens.
Yeah, I appreciate that. Well, we're going to leave information in the show notes again, and you can connect with Drug Free America and Amy and just learn more than what we talked about today. But I do want to bring this to a wrap. I appreciate you being here. Thank you so much for taking time to have a conversation with us, Amy.
Absolutely. Thank you for having me.
And thank you for listening to Prevention Perk, a podcast from Mid-America PTTC. To learn more about our innovations, visit pttcnetwork.org and look under the PTTC tab for the Mid-America link. Remember, prevention is better together, and together we are stronger.